Hi guys, it's me, Professor D, and welcome back to my channel. On this video, I'm going to be covering reproductive disorders. Specifically, I'm going to be covering breast disorders, uterine disorders, pelvic floor disorders, okay? So if you haven't done so already, guys, please don't forget to like and subscribe below. I can't speak. Like and subscribe below. Also, guys, don't forget, I'm on TikTok and Instagram. My handle is still the same, Nexus Nursing. And I also have a podcast that's released every Sunday, the same day and time as my YouTube video, Sunday at 1 p.m. And I'm on all major platforms for my podcast for nursing students and NP students. Again, the handle's the same, Nexus Nursing. One last thing before we get started, guys. Don't forget, my audio lessons are now available on my website, nexusnursinginstitute.com. Whatever class you're taking right now in the program, if you're struggling, you need help, you want to hear my voice point things out to you, let you know what's important to know for your next exam, go ahead and check that out on nexusnursinginstitute.com. On my website, you will also find the information for my podcast if you'd like to listen to my podcast. I've also got some of my YouTube videos up, as well as some content that I cover on TikTok and Instagram as well. So guys, without any further ado, let's get started. First question. The client frequently finds lumps in her breast, especially around her menstrual period. What information should the nurse teach a client regarding breast self-care? 1, this is a benign process that does not need follow-up. 2, the client should eliminate chocolate and caffeine from the diet. 3, the client should practice practice breast self-examination monthly. Or 4, this is the way that breast cancer begins and the client needs surgery. All right, guys, and the correct answer is 3. The client should practice breast self-examination monthly. Now, yes, it needs to be monthly, but let me be more specific, okay? Let me take that teaching a little bit further. If the woman is still having her menstrual period, you're going to teach her to do the breast self-exam about 1 week after her menstrual cycle. Why? Because her hormones have gone back to normal. Because what happens is during a woman's menstrual cycle, right before she has her menstrual cycle, the hormones are out of whack, and what she may feel that she feels is a lump. It could possibly be a cyst, and just her hormones are just out of whack. But a week after she has her menstrual period, it should be back to normal, and that's when you tell her to check herself every month, 1 week, 7 days after she has her menstrual period. Now, let's say that woman's postmenopausal. Well, she doesn't have a menstrual period anymore. So what are you going to teach her? You're going to teach her to choose an important day every month. Maybe it's the first of the month. Maybe it's the day that she has to pay her mortgage, whatever. You teach her to choose a day every month to check for breast and her lump and to do the self-breast examination. All right, next question. The client is diagnosed with breast cancer. Oh, I'm sorry. I just did that one. Next question. The client has undergone a wedge resection for cancer of the left breast. Which discharge instructions should the nurse teach? 1, don't lift more than 5 pounds with the left hand until released by the doctor. 2, the cancer has been totally removed and no follow-up will be required. 3, the client should empty the hemovac drain about every 12 hours. Or 4, the client should arrange an appointment with a plastic surgeon for reconstruction. All right, guys, and the correct answer is 1. Don't lift more than 5 pounds with the left hand until released by the doctor. We don't want any pressure on that site. Remember, the patient just had surgery, so until they've been released by the doctor, we don't want them lifting anything heavy, nothing, no stress, no pulling on that site. Now, choice number 2, because I want to go over the wrong choices, guys. Let's go over the wrong choices. Choice number 2, the cancer has been totally removed and no follow-up therapies. When have you ever known that a patient had cancer and no follow-up was ever needed? Come on. And guys, I talked to you about all-inclusives as well. Stay away from them. The cancer's been totally removed. No follow-up is necessary. Stay away from those all-inclusive, and never choose an all-inclusive answer unless you know beyond a shadow of a doubt that that's the correct answer, and it's not. So that's wrong. Next choice, the client should arrange an appointment with a plastic surgeon for reconstruction. Why do they need reconstruction? This was a wedge resection, so that's wrong. And then choice 4, the client, where am I, guys? I'm sorry. I covered, oh, I'm sorry, I skipped number 3. The client should empty the hemovac drain every 12 hours. They don't need a hemovac drain. This was like a wedge resection. A hemovac drain is not needed. Breast reconstruction is not needed because the breast was not removed. Remember, this was a wedge resection. So guys, the correct answer is 1, no lifting more than 5 pounds. And the reason for that, guys, we don't want any pressure, any pulling on that surgical site. Next question. Which recommendation is the American Cancer Society's guideline for early detection of breast cancer? 1, beginning at age 18, have a biannual clinical breast examination by a doctor. 2, beginning at age 30, perform monthly breast self-exams. 3, beginning at age 40, receive a yearly mammogram. Or 4, beginning at age 50, have breast sonogram every 5 years. And guys, the correct answer is 3, beginning at age 40, have a yearly mammogram beginning at age 40, have a yearly mammogram. So guys, this is done to detect any lumps that, you know, when you do your breast self-exam every month, you may not be able to feel it with your fingertips. So that mammogram is more precise, more detailed. It may feel the lumps that you may not have necessarily been able to feel by your monthly self-exam. So that's why number 3 is the correct answer. Now let's look at our wrong answer choices. 1, beginning at age 18, have a biannual clinical breast exam by the doctor. First of all, it's beginning age 30, not age 18. And second of all, it said biannual, but beginning at 30 years old, you need to have it annually done. Annually, when you hit 30, annually, when you go to the doctor, you need to get a breast self-examination performed. Choice 2, beginning at age 30, perform monthly breast self-exams. Well, that's wrong. Beginning at age 18, we want to do the breast self-exam. Remember, the breast self-exam is the one that you do in your home. That's not the one you go into the doctor's office to get done. By the way, let me just make a little side note. Even though it's 18, for young girls, adolescents who have very large breasts, we encourage them to do it earlier. So if they have very large breasts, they can begin around 14 years of age, but the standard is 18. And the last answer choice, beginning at age 50, have a breast sonogram every 5 years. That's incorrect. The sonogram is done only after the mammogram, and that's only after an abnormality's been noted on the mammogram. So the woman gets the mammogram done, and if there's an abnormality noted, then they get that sonogram done, but it's not something that's routine. And so that's why number 3 is the correct answer. You want to start getting the mammogram every year at the age of 40. The nurse is teaching a class on breast health to a group of ladies at a senior citizens center. Which is the most important risk factor to emphasize to this group of ladies? 1, the client should find out their family history of breast cancer. 2, men at this age can get breast cancer also and should be screened. 3, monthly breast self-exams is the key to early detection. 4, the older a woman gets, the greater the chance of developing breast cancer. Okay, guys, and the correct answer is 4. The older that the woman gets, the higher her chances are of getting breast cancer. So the number 1 risk of getting breast cancer is being a female, period. If you're a female, that is the number 1 risk of getting breast cancer. Number 2 is age. The number 2 risk is age. The older that you get, the higher your risk of getting breast cancer. Matter of fact, guys, I hate to even verbalize this statistic because it's so heartbreaking, but it's true. 1 out of every 8 women are diagnosed with breast cancer. 1 out of every 8 women. Okay? So the longer that you've lived on this earth, the higher your risk, if you're female, the higher your risk is of developing breast cancer. All right? Oh gosh, every time I say it, I get chills, but that is the truth. So the number 1 risk factor is being female. Number 2, right after being female, is age. The older that you are, the higher your risk is. The client who's 4 months pregnant finds a lump in her breast and the biopsy is positive for stage 2 cancer of the breast. What treatment would the nurse anticipate the doctor recommending to the client? 1, a lumpectomy be performed after the baby's born. 2, a modified radical mastectomy. 3, a radiation therapy to the chest wall only. Or 4, chemotherapy only until the baby is born. And guys, the correct answer is 2, a modified radical mastectomy. Now, let's talk about these wrong answer choices. 1, a lumpectomy to be performed after the baby's born. Go back to the question. She's at stage 2. And it says that she's only 4 months pregnant. So do we really want to sit on this and wait and allow this cancer to grow and possibly metastasize to do anything about it? Absolutely not. So it's not going to be number 1. Number 3, radiation. Let's stop right there. She's pregnant. Can she get radiation? No. Now, let's say you didn't even catch that radiation part. Let's keep going. It says radiation therapy to the chest wall only. Is it only an all-inclusive? Did not tell you to stay away from the all-inclusives. I just talked to you guys about that. So that's wrong. Let's look at choice number 4, chemotherapy. She's pregnant. Can she get chemotherapy? Absolutely not. Let's say you didn't catch that. Let's keep going. Chemotherapy only. Guys, if you do not know the answer to a question and you see an all-inclusive such as only, always, never, don't choose it. Okay, so our correct answer, guys, is a modified radical mastectomy. She's pregnant. She can't get radiation. She can't get chemo. And we definitely don't want to wait until after she delivers the baby to do something about it. So you're going to choose the answer of the modified radical mastectomy. Next question. The client who has had a mastectomy tells the nurse, my husband will leave me now that I am not a whole woman anymore. Which response by the nurse would be most therapeutic? 1, are you afraid that your husband will not find you sexually appealing? 2, your husband should be grateful that you'll be able to live and be with him. 3, maybe your husband would like to attend a support group for spouses. 4, you don't know that's true. You need to give him a chance. And guys, the correct answer is 1, are you afraid that your husband will not find you sexually appealing? So guys, what is the nurse doing? She's basically restating what the patient just said. Restating is a form of therapeutic communication. You're allowing that patient the opportunity to express their feelings. Now let's look at our wrong answer choices. 2, your husband should be grateful. Stop. Do we ever give advice or our opinions in nursing? Absolutely not. That's wrong. It's not therapeutic. 3, maybe your husband would like to attend a support group for spouses. So you're not even going to address how that patient feels. And matter of fact, when you offer that support group without even assessing how that patient feels, you are basically confirming that, yeah, he probably feels that way, so let's just go ahead and get him a support group. No, the issue at hand is your patient is in distress, and that's what you need to address. So that's wrong. And 4, you don't know that's true. You need to. Excuse me? Do we give advice in nursing? Absolutely not. That is not therapeutic. So number 1 is your correct answer. The client has been diagnosed with cancer of the breast. Which would be the most appropriate referral for the nurse to make? 1, the hospital social worker. 2, cancer amount. 3, reach to recovery. Or 4, I can cope. And guys, the correct answer is 3, reach to recovery. Guys, this is a referral program for patients with cancer, but specifically breast cancer. Okay, so that's why number 3 is the correct answer. It's a program specifically for breast cancer patients and survivors. Now let's look at our other answer choices. 1, the social worker. Social workers help patients with financial resources and resources in the community. For anyone, it doesn't have to be breast cancer, anyone. 2, Cancer Amount. That is a program that works with cancer patients, but all cancer patients, not specifically breast cancer. And 4, I Can Hope. It's a cancer education program, but again, it's a cancer education program for all types of cancers. But choice number 3 is specific to breast cancer. Next question. The nurse is assessing the client diagnosed with erectocele. What signs and symptoms would the nurse expect? Select all that applies. Guys, how do we treat select all that applies? As true or false. So let's go. Remember, the patient has a what? Erectocele. 1, rectal pressure. Absolutely. Why? This refers to what? Bowel elimination. Absolutely. 2, flatus. What is flatus? When the patient has gas, they're farting all the time. Absolutely, guys. This refers to, again, what? The GI tract. True. 3, fecal incontinence. Absolutely, guys. Again, this refers to the GI tract and bowel elimination. 4, constipation. Absolutely, guys. We're talking about erectocele. This, again, refers to the GI tract, bowel elimination. 5, urinary frequency. No, that refers to the urinary tract. That refers to GU. So our correct answer is 1, 2, 3, and 4. Guys, that rectocele, what are we talking about? Where there's a wall, but that wall is very weak between the vagina and the rectum. It's very weak. And so the patient's going to feel that pressure, that flatus, that incontinence, that constipation. But not urinary frequency. Urinary frequency, that has to do with the urinary tract and not that weakness that's in that wall of the rectum. Okay, so the correct answer is 1, 2, 3, and 4. What intervention should the nurse implement for a client diagnosed with erectocele? 1, limit oral intake to decrease voiding. 2, encourage a low residue diet. 3, administer a stool softener daily. Or 4, arrange for the client to take a sitz bath. And I know you guys all know this answer because I just talked to you about this in the last question. The correct answer is 1, administer a stool softener daily. Why? Because one of those symptoms that we see in those patients with erectocele is what? Constipation. So let's look at our wrong answer choices. 1, limit oral fluids. No, constipation is a problem, so we want them to what? Increase fluids. We want that stool to be soft, so it's not hard for that stool to come out. 2, encourage a low residue diet. Well, we just talked about this, or I just talked about this. They go through what? Constipation. So do we want a low residue diet? No, we want a high residue diet. We want lots of fiber, right? To make the ease of having that bowel movement much easier. Choice 4, arrange for the client to take a sitz bath. That doesn't do anything for treatment or helping with the erectocele, so that's false. So the correct answer is a stool softener. What specific complication would the nurse assess for in the client with a uterine prolapse recovering from an anterior and posterior repair? 1, orthostatic hypotension. 2, atelectasis. 3, Allen sign. Or 4, Homan sign. And guys, the correct answer is Homan sign. I want you to think about it. When you think of a positive Homan sign, what are we thinking of? DVT. Well, think about it. Let's go back to the question. And what was this patient recovering from? Abdominal hysterectomy. Oh, excuse me, I'm on the wrong question. Where are they recovering from? A uterine prolapse. And they had, look at this, anterior and posterior repair. So what position was this patient in for surgery? Lithotomy. That patient is in a lithotomy position. Any patient that has to be in a lithotomy position for an extended amount of time, what are we worried about? DVT. Why? Because in that position, it's very easy for blood to not flow the way it's supposed to in the lower extremities. Blood pools. What happens when blood pools? It starts to clot. What happens when it's clot? That clot can move before you know it. DVT, or maybe even go to the lungs and turn into a pulmonary embolism. So the correct answer for this is Homan sign number 4. Which information should the nurse include in the discharge teaching for a client recovering from an abdominal hysterectomy? 1, the client should report any persistent vaginal bleeding or cramping to the surgeon. 2, the client should start vigorous exercise routine to restore her muscle tone. 3, the client should continue sitting in the bedside chair for at least 6 hours daily. Or 4, the client should soak in a warm bathtub each night for 1 hour. And guys, the correct answer is the client should report any ding, 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 persistent. If you guys watch my video that I did on words to watch out for when you're studying for NCLEX, you would have gotten this right. Okay? Persistent vaginal bleeding or cramping to the surgeon. First of all, after a patient has surgery, what are our top 3 concerns? Hemorrhage, bleeding that won't stop, that's persistent, infection, or DVT/pulmonary embolism. There you go. Okay, now let's look at our wrong answer choices. 2, the client should start a vigorous, it didn't just say exercise, it said vigorous. That's another way for saying strenuous, right? Wrong. I'm not even finishing the rest of that question. Wrong. Choice 3, the client should continue sitting in the bedside chair for at least 6 hours a day. Look, guys, the patient just had abdominal hysterectomy. Why would we have them sitting in the chair for at least 6 times a day? Do we really want to increase the pressure on that pelvic cavity? Does that make any kind of sense at all? Absolutely not. So, guys, that is wrong. And then choice number 4, the client should soak in a warm bathtub each night for at least 1 hour. When in nursing have we ever told patients to soak in bathtubs? What happens when you soak in bathtubs? What does it increase the risk of? Infection, UTI. Patient just had surgery. One of the top 3 things we're concerned about is hemorrhage, DVT/PE, and what? Infection. So guys, the correct answer would be number 1. Excuse me. Which nursing task could be delegated to the unlicensed assistive personnel for the client who had a total vaginal hysterectomy? 1, observe the color and amount of drainage on the client's perineal pad. 2, maintain a current INO of the client each shift. 3, provide the client with a plan of pharmacological pain management. Or 4, prepare the client for discharge scheduled for the next day. And guys, the only thing that the UAP can do is number 2. Remember, they're not licensed, so they cannot EAT. They cannot explain, examine, or evaluate. They cannot assess, and they cannot teach. All right? So the only thing they'll be able to do here is number 2. Maintain the current INO. Because remember, unlicensed assistive personnel, CNAs, PCTs, they can record and report. The client in the gynecology clinic asked the nurse, what are the risk factors for developing cancer of the cervix? Which statement would be the nurse's best response? 1, the earlier the age of sexual activity and the more partners, the greater the risk. 2, eating fast foods that are high in fat and taking birth control pills are risk factors. 3, chlamydia trachomatis infection can cause cancer of the cervix. Or 4, having yearly pap smears will protect the client from developing cancer. And guys, to answer the question, it's number 1. The earlier that the patient starts having sex and the more partners that she has increases her risk. The correct answer is number 1. And by the way, guys, this is just asking about cancer of the cervix, but it also increases the risk for HPV, HIV, and other sexual transmitted infections and diseases. The client diagnosed with cancer of the uterus is scheduled to have radiation brachytherapy. Which precautions should the nurse implement? Select all that applies. Guys, how do we treat select all that applies? As true or false. Very good. I'm so proud of you guys. Very good. Let's go. 1, place the client in a private room. Absolutely. Why? We want to decrease exposure. We don't want anyone else to be exposed. Absolutely. They are not going to have a roommate. They are going to be in a room by themselves. Number 2, wear a dosimeter when entering the room. Absolutely. That's how the nurse and anybody else, any other healthcare provider, is going to be able to keep track of how much exposure they've been exposed to. How much radiation they've been exposed to. Absolutely true. 3, encourage visitors to come and stay with the client. No, guys, we're trying to decrease exposure, not increase exposure, so that's false. 4, plan to spend extended time with the client. Absolutely not. We're trying to decrease exposure, not increase exposure. For this type of client, guys, you are going to cluster your activities. You're going to plan what you're going to do, go in there, bam, 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 get it done, then get the heck out of there. Okay, we're trying to decrease exposure, not increase exposure. 5, notify the nuclear medicine technician. Absolutely, they're the one who's going to be helping with the placement of the implant, and they have to put that lead-lined container. Remember that famous nursing test question I told you about, that implant came out, what do? And you pick it up with, you find it on the floor, you pick it up with those lead, the tongue, and you put in the what? Lead-lined container. Well, guess what? The nuclear technician, they're the ones who's going to put that lead-lined container in the patient's room. So the correct answer is 1, 2, and 5. The postmenopausal client reveals that it's been several years since her last gynecological examination and states, "Oh, I don't need that anymore. I'm beyond having children." Which statement should be the nurse's response? 1, as long as you're not sexually active, you don't have to worry. 2, you should be taking hormone replacement therapy now. 3, you're beyond bearing children. How does that make you feel? 4, there are situations other than pregnancy that should be checked. And guys, the correct answer is 4, and that's absolutely right. There are other situations other than pregnancy that should be checked. Cervical cancer, endometrial cancer, all types of things that need to be checked. Absolutely. Now let's look at the wrong answer choices. 1, as long as you're not sexually active, you don't have to worry. First of all, do we ever say to patients, don't worry? No. So that within itself is wrong, right? But the whole statement is wrong. Even if you're not sexually active, there's other things that we need to be concerned about and we need to assess you for. So that's wrong. Choice number 2, you should be taking hormone replacement therapy now. Excuse me, do we give medical advice? Absolutely not. As nurses, we do not give medical advice. That's wrong. Choice 3, you're beyond bearing children. How does that make you feel? That's a therapeutic response, but that's not the answer to the question. Because the patient just said something that made us know that they need further teaching. So our job at that moment is to provide that further teaching, not talk about their feelings. So that's wrong. Number 4 is the correct answer. Okay, guys. The client has had a total abdominal hysterectomy for cancer of the uterus. Which discharge instruction should the nurse teach? 1, the client should take hormone replacement therapy every day to prevent bone loss. 2, the client should practice pelvic rest until seen by the doctor. 3, the client should expect some bleeding after the procedure. Oh, guys, I'm sorry. 3, the client should drive a car as soon as she's discharged from the hospital. And 4, the client should expect some bleeding after this procedure. And guys, the correct answer is 2, the client should practice pelvic rest until seen by the doctor. Why? Go back to the question. What did they just have? Total abdominal hysterectomy. So we don't want to put any pressure on the vagina. So no sexual intercourse, no tampons, nothing inserted into the vagina until cleared by the doctor. Okay, the other choices are wrong. We have 1, the client should take HRT every day to prevent bone loss. So the patient just had a total hysterectomy. You know what total means? That means everything was removed, including the ovaries. Well, in this question, it just said total. So what do we know? The ovaries are responsible for what? Those hormone production. So that's really not going to be a concern now because everything's been removed. So number one is the incorrect answer. It's completely wrong. But number 2, that's not even our priority. Look at what kind of surgery the patient has. We want to make sure that nothing is being placed into the vagina. Choice number 3, the client can drive as soon as discharged from the hospital. Again, guys, we don't want to put any pressure on that lower pelvic area. And that patient being in a sitting position, such as driving, will be putting pressure on that area. So that's false. And the last choice, the client should expect some bleeding. For this type of procedure, we should not expect any bleeding. So that's incorrect. If the patient does experience some bleeding, we want them to report it right away. So the correct answer, guys, is going to be 2. The client should practice pelvic rest until seen by the doctor. No tampons, no sex, no pressure, nothing inserted into the vagina until cleared by the surgeon or the doctor. All right, guys, we are down to our last question. The client diagnosed with uterine cancer is complaining of lower back pain and unilateral leg edema. Which statement best explains the scientific rationale for these signs and symptoms? 1, this is expected pain for this type of cancer. 2, this means the cancer is spread to other areas of the pelvis. 3, pain is a result of the treatment of uterine cancer. I'm sorry guys, I'm not wearing my glasses. 4, radiation treatment always causes some type of pain in the region. And guys, the correct answer is 2. This means that the cancer has spread to other areas of the pelvis. Go back to the question. It says the client's diagnosed with uterine cancer, but now they're complaining of lower back pain and unilateral leg edema. I've talked about this extensively on my other videos, but guys, if you're new to my channel, I'm going to tell you this because this is famous for test questions. If you understand this concept, you're going to get a lot of test questions right when it comes to cancer. Pain is the last symptom. By the time that patient feels pain, it's metastasized. And that is why cancer is so deadly. Okay? If most cancers, we catch it early enough, the patient has a great chance. But what happens is the patient usually doesn't realize anything's wrong until they feel pain. They feel pain. That's what prompts them to go to the doctor and get checked. And by that time, it's already spread. By the time that patient feels pain, it's metastasized. Pain is one of the last symptoms that we see when it comes to cancer, where other diseases and disorders, pain is the first symptom. Patient feels pain, they go to the doctor, we find out what it is, patient gets help. But when it comes to cancer, pain is the last symptom. So by the time they get pain, it's already metastasized. All right, guys, that is the end of this video. I hope you found this video to be helpful, guys. As always, I'm asking you to please help my channel grow. Share my content with other nursing students, anyone that you think would benefit from my content. Please don't forget, I have a podcast and I'm streaming on all major platforms, Nexus Nursing. Also on TikTok, I'm on Instagram. Check out my website. I have audio lessons available right now, nexusnursinginstitute.com. Thank you so much for sharing this time with me, and you'll be seeing me on the next video.